Eligibility. You can enroll in the insurance plans offered through OCGIB if you are a current education employee who participates in the teacher's retirement system and is working a minimum of 4 hours a day or 20 hours a week, or if you are a current local government or a non-education employee who is regularly scheduled to work at least 1,000 hours in a calendar year. You cannot be classified as temporary or a seasonal employee. Your eligibility for insurance coverage does not guarantee that your employer will contribute towards your insurance premiums. Check with your insurance coordinator about premium contributions made by your employer. Dependent enrollment. You may enroll your eligible dependents in the same benefits you carry. Eligible dependents include your legal or common law spouse, unmarried children up to the age of 25, and disabled children over the age of 25 with approved documentation. Stepchildren may be eligible for coverage as well. You cannot enroll your dependents in any coverage that you don't carry yourself. For example, if you want to enroll your dependents in a dental plan, you must also enroll in that same dental plan. Other dependents. Other children may be eligible for coverage as long as you are financially responsible for their support. Other dependents can include nieces, nephews, grandchildren, and other minors. If the child or children are not listed as dependent on your income tax return, a declaration of dependency form must be submitted and approved by OCGIB before your dependent can be added to coverage. This form is available from your insurance coordinator. Dependents do not include your parents, grandparents, or other adults. Dependent eligibility. If you cover one dependent under any benefit, all your eligible dependents must be covered under that same benefit. There are certain exceptions to this requirement. Eligible dependents can be excluded from coverage if they already have other group insurance of the same type. You may exclude these dependents at the time you enroll or within 30 days of your dependents gaining other group insurance coverage. Your spouse can be excluded from all coverage except vision. You and your spouse must both sign the spouse exclusion certification on the back of your insurance enrollment change form. Mid-year qualifying events. Certain qualifying events may allow you to make a mid-year change. Examples include marriage, divorce, adoption, death, childbirth, and the gain or loss of other group insurance coverage. Requests for changes in your insurance coverage must be made within 30 days of the qualifying event, or the request may be denied. It should be stressed that financial hardship is not considered a qualifying event to drop or change coverage. Insurance enrollment form. New employees must complete an insurance enrollment form. It's important to write legibly and include all the required information. Incomplete forms may delay your enrollment. Under plan selections, clearly mark your plan choices. If you choose to enroll in life insurance, indicate the amount of coverage you want to carry. The back of the insurance enrollment form is used to enroll your eligible dependents. Remember, you cannot enroll your dependents in any coverage that you don't carry yourself, and you must enroll all eligible dependents. You, your spouse if necessary, and your insurance coordinator must sign the insurance enrollment form. If your form does not have the required signatures, the processing of your enrollment will be delayed. Insurance change form. If you need to make a benefit change in the middle of the plan year because of a qualifying event, you must fill out an insurance change form and return it to your insurance coordinator within 30 days of the date of the event. Clearly indicate on the form the type of change you are requesting. Once you submit your insurance change form, most changes will be effective the first day of the month following the qualifying event or the date you return your form to your insurance coordinator. The back of the insurance change form is used to make coverage changes for your dependents. Clearly mark any changes and then sign and date your form. Remember, your spouse must sign the spouse exclusion certification if appropriate. 2010 Option Period Enrollment Change Form. A personalized option period enrollment change form will be provided to you if you were enrolled with OCGIB prior to October 2009. Carefully review your current coverage information, which can be found in Section B of your option period enrollment change form. Clearly mark any changes you wish to make for the new plan year beginning January 1st, 2010. The back of your form is used to make coverage changes for your dependents. Clearly mark any changes and then sign and date your form. Remember, your spouse must sign the spouse exclusion certification if appropriate. Deadlines for enrollment and change forms. Option period enrollment change form. Each option period, your insurance coordinator will provide you the deadline for returning your option period enrollment change form. New employee enrollment form. As a new employee, you must return your insurance enrollment form to your insurance coordinator within 30 days of your hire or eligibility date. Failure to return your form in a timely manner may result in the delay of your enrollment. Insurance change form. For changes to benefits due to a mid-year qualifying event, you must complete and return an insurance change form within 30 days of the event. Failure to return your form in a timely manner may result in the denial of your benefit changes. Confirmation Statement. OCGIB will mail you a confirmation statement when you enroll and each time you make a change in your benefits. When you receive your confirmation statement, review it carefully to confirm that your information is correct. If you find an error on your confirmation statement, contact your insurance coordinator to get it corrected. Your insurance coordinator has a limited period of time to make corrections. During option period, members who do not make any changes to their coverages will not receive a confirmation statement. We encourage you to keep a copy of your option period enrollment change form to verify your coverage. Things to remember. Option period is the only time that you can make changes to your coverage without a qualifying event. Dental and life insurance are not available unless you have proof of group health insurance. If needed, your spouse must sign the spouse exclusion certification or the common law spouse certification section of the insurance enrollment or change form. You must sign and date your form and return it to your insurance coordinator within the set deadline. If you have a change of address, please notify your insurance coordinator. We hope this presentation has answered most of your questions concerning benefits and enrollment. If you have questions that are not addressed in this presentation, several resources are available. Your insurance coordinator is a valuable source of information. The 2010 Employee Benefit Options Guide has more detailed information about the plans available. The website addresses and toll-free customer service numbers for each plan can be found inside the back cover of the Employee Benefit Options Guide. The Frequently Asked Questions section of the OCGIB website can also provide the answers to many of your questions, or you can call OCGIB Member Services at 1-405-717-8780 or 1-800-752-9475. TDD users call 1-405-949-2281 or 1-866-447-0436. Thank you. This concludes the 2010 Employee Benefit Options presentation.